There are 3 different kinds of fat that I think about as a plastic surgeon that you need for the best results. So classically, when we do liposuction, we would just throw it away. Well, today we can actually use that very valuable stuff to actually enhance your overall looks. So for the breast, for the body, for breast reconstruction, for trauma, and really for bigger areas, we typically will do fat harvesting, liposuction, process the fat, not very much, and then place it back in your body. The actual cannula or tubes that we put the fat back into you are relatively bigger diameter, sort of a bigger hole. And what that allows us to do is give you more bulk. And initially, you can feel like, hey, this is a little lumpy. This feels like a slight bump. That should not stay there for a long period of time. In fact, it usually goes away in a couple of days. And that's the advantage of actually being able to do fat grafting to larger areas. Traditionally with Brazilian butt lift, for breast augmentation utilizing your own fat, it is safe and effective to use that kind of fat. Now, there's something known as microfat. So that's typically used in the face or other parts of the body. I have to do liposuction or auto harvesting or fat harvesting the usual way. However, I actually have to filter or process that fat a little more. The fat looks a little more like liquid. A lot of times it can actually look like jelly. And it's a little thicker than liquid, but it is not liquid. Also, it's thinner than when I do fat grafting for the buttock, for the breast, for the face, or for traumatic areas. So, why is that important? We don't want lumps or bumps to form in your face. So typically this type of microfat is placed in the cheeks, in the nasolabial fold, sometimes in the lips, and we try to avoid using it in areas that have very thin skin. The third type of fat for fat grafting is called nanofat. Sometimes it's called liquid fat. So this is highly filtered, highly processed fat. It actually looks like liquid. Now it does have a bunch of wonderful growth factors and a bunch of other things going on there so that it's fat grafting where it can rejuvenate the area and give you a better looking skin overall. We typically give this in areas of very thin skin. The most common area is the under eye, right around here. We don't want any lump to form or any potential lump, and we want to make sure that you still get the rejuvenating effects of fat. However, we don't want any hardness, any lump, anything at all to form after surgery. So which one's right for you? Again, talk to your plastic surgeon, but now you know anatomically what I'm thinking of as a plastic surgeon to give you the best results. Fat grafting is a wonderful enhancement for your facelift, for your breast augmentation, for life in general, to be honest, because it is your own body's natural filler. It cannot be rejected. It's part of you. And fortunately or unfortunately, a lot of us have a little extra fat harvest sites so that it's easy to donate. If you have any questions or any comments, please fire away below. Thanks so much for watching.